You hear that, cows?
Hear that, cow?
You guys know if you're giving an honest effort, okay? If you're honest in what you do, okay? Tonight, I want to see an honest effort. Everything
I'm a single, full-time working mom. I have 2 boys, 8 and 10. We are very active. We snow ski. My kids play lacrosse and soccer. We're constantly on the go. I did previously have health care. I had it for about 3 or 4 years, an individual policy. Unfortunately, I had to end that policy because it became too expensive.
Insurance has been a sore subject for years and years and years.
For health care, it's never a matter of if. It's always a matter of when.
And they say, well, if my employer doesn't offer health insurance, well, I don't have health insurance.
My rates continuously went up, and I just couldn't do it anymore. I couldn't provide for my boys and pay other, bills.
Pre-existing conditions for us, it was a big nightmare.
People getting care when they need it, not waiting until it's too late.
Insurance is like a parachute. Yeah, you don't want to need it when you don't have it. You won't always want to have it when you need it.
You hear about all the changes and you don't know where to go. You don't know what to do. I mean, especially for us where we had the pre-existing condition before. You can't let it lapse, and you have to really stay on top of it. It was really a nervous time before this came.
What you pay for insurance is now based on a percentage of your income. And it's going to be very affordable. Most of the people in Idaho benefit the most from this because we have the lower wages across the country. If you take the same income scale to California or to New York or New Jersey, it's horrible, but for Idaho it really works out well.
The need's been huge because we have a high number of small businesses and many can't afford insurance to buy insurance, so it's a great deal.
So many of Idahoans qualify for tax credits, and I think there's a lot of people that really don't realize that there are tax credits are available to help offset the cost of the health insurance.
A lot of people are surprised that the health insurance is more affordable now.
I've had people who walked into the office that were really disgruntled that they were being forced to buy health insurance, that the government was mandating that they do this or they do that. And in Idaho, we're a little bit independent-minded. We don't like to be told what to do. And so I think that has created maybe a little bit of standoffishness in people that haven't wanted to do that. But I've had people come into my office and we go through their information, I gather their information, we look at the options and show them, hey, this is what's available, this is the option, and they walk out and their eyes get big and say,
wow, really? For both of us? Because see, I haven't had insurance for 10 years.
I think some of the other surprises are how rich the benefits are. Some of those things have been covered in the media, like preventive services or wellness visits.
The doctor said if you wouldn't have come in when you did, you would have lost your sight in a year.
You need to be protected because you never know what's going to happen, when you're going to get sick, when you're going to have an accident.
That's what insurance is about, protecting you and your family and whatever resources you have from that kind of a risk.
If you're hesitant about signing up or scared or have questions, contact a local insurance agent. They will answer any questions. They're so very helpful.
Idaho at the very beginning said, let's keep insurance agents and brokers involved in the process. That was a smart decision.
We're just Idahoans here to help other Idahoans.
That's what we do. That's what our role is, to make it as easy and simple as possible to help you get through the process, to help Idahoans find the best plan that's going to meet their needs.
There has been a lot of noise, both positive and negative, about the Affordable Care Act health insurance exchanges. Don't let that noise keep you from taking care of yourself. We have an array of 500 to 600 insurance agents everywhere in Idaho, trained on the exchange, willing to help people for nothing, and have the expertise to understand the ins and outs of insurance. It's a great deal for people.
And then the question they ask is, well, what do I owe you for this? And I just laugh and I thank them for asking me that, and I say, you know what, the great thing is, you don't owe me anything at all. There's no additional cost for the services of an agent or broker.
There's a bunch of information on the Your Health Idaho website that you can go to that will answer your questions. Just ask questions, just start diving in, and if it's not for you, it's not for you, but it was for me.